The topic which I have taken on herbal galactagogues, it is really very primitive in the very primitive stage because there is no reference in sheep and goat. Whatever I could gather was from cattle and buffalo. So the dose what is referred for these large animals can be given in sheep and goat. First of all, I must tell you what are the difference between allopathic medicine, Ayurvedic and homeopathic medicine. So the word meaning of allopathy means dissimilar or heterogeneous, and pathos means suffering. And Ayurveda is a Sanskrit word where Ayush means life and Veda means knowledge. And homeo is similar and pathos is suffering. So same homeopathy deals with the theory of dilutions. The more dilution, the more effective the drug is. The principle of allopathy is the drug-oriented methodology and relies on three things: hypothesis, experimentation, and the result of the experiment. There should be, in Ayurveda, there should be a balance between the three elemental energies, that is Vayu, Pitta, and Kapha in the body. Imbalances in any one of these will make the body unhealthy. While in homeopathy, it is like cure like based on methodology, and that is substance that symptoms of a disease on healthy animals, they will cure, they will have a curative effect on the sick animals. And allopathy, the focus point is it concentrates on the symptoms of a disease and not on the root of the cause. It only works on the symptom, but the disease may reoccur again. But in Ayurveda, it concentrates on the root cause and provides permanent cure and permanent immunity, though the treatment duration is long. Whereas allopathy, the treatment duration is quick. You can get the result in 3 to 5 days. And homeopathy, it concentrates on the body's natural response system by attacking the root cause of the illness. So it will aggravate the symptoms first, then slowly the response will be seen. The advantage of allopathy is it can be used in case of emergencies because the result is quick. If there is emergency, we should go for allopathy. Ayurveda, it treats the disease using medicines derived from the nature. So in the village condition, if there is plenty, where there are plenty of herbal plants, and if we know about the plant, we should go for herbal treatment if the condition is not so severe. In acute cases, if there is emergency, we should go for allopathy. Whereas if there is time, we can go for, in case of skin disease, the treatment of Ayurveda is very useful. Whereas homeopathy, it stimulates the immune system to fight against the disease. The duration of immunity will be long and the disease will be cured from the root. The side effects in all the three, there is some side effect in allopathy. Ayurveda, if it is the dose is given in heavy dose, they will cause few reactions. Whereas homeopathy, there is no side effect when taken in adequate amount. In homeopathy, it can also be given with allopathy. It has been seen if there is a gap duration of 1 to half an hour, homeopathy and allopathy can go together when there is need. Now coming to the main topic, what is agalactia and hypogalaxia? Agalactia means absence or failure of secretion of milk. It may be due to any infection or any obstruction in the letdown of milk. The main problem is mastitis, and contagious agalactia in small ruminants is a serious disease which affects lactating females and their young ones, causing significant mortality. Contagious agalactia in small ruminants is caused by Mycoplasma agalactiae. Whereas hypogalaxia or dysagalaxia means there is partial loss of milk production. It is seen frequently in herds on a routine basis. This may be due to any managemental defect or there is mineral deficiency. There is some problem in the diet, managemental problem. Whereas in Agalactia, Streptococcus agalactiae and Streptococcus dysagalaceae causes mastitis and leading to complete cessation of milk. Then contagious Agalactia in small ruminants results in mastitis, arthritis, and conjunctivitis. There may be fever, loss of appetite, lethargy, or weakness, which is commonly seen. The advantages of herbal medicines, they constitute chemicals as a revolution between flora and fauna, leading to development of optically chiral molecules with specific reactions in the mammalian body. The milk production has direct impact on the growth, development, and health in the neonatal period in non-infectious agalaxias as well as hypogalaxias. The galactogogues, which are the herbal preparations, focuses on the mechanism by which milk production stimulation is achieved. Discovery of new active compounds with novel structure which have potential to serve as a natural lead compound for development of new galactogogues has been discovered. Now coming to the process of lactogenesis. As you know, the herbal galactogogues they stimulate the hormones as which is recorded in the natural process of lactogenesis. Most growth of the mammary gland occurs during the pregnancy. In the early stages of pregnancy, the ducts they branch. There is branching of the ducts in the early stages, and they grow profusely under the influence of these hormones. During the middle and later stage of pregnancy, the milk secreting alveoli they form. The alveolar growth is seen, and progesterone acting with estrogen, which is responsible for the formation of alveoli. The ducts continue to branch and they grow. Then, in the later stage, after few weeks of pregnancy, in the last few weeks of pregnancy, the alveoli begins secreting some products, some milks, and there is high level of estrogen and progesterone, which inhibit the lactation period. Then, once the fetus there is given, when the doe gives birth to the kid, there is a high level of estrogen and progesterone in the blood level drops, and there is with the low level stimulate the production of prolactin by the pituitary gland, along with the adrenal corticoids and the growth hormone. The prolactin is responsible for the initiation of lactation. The lactation is maintained by stimulating hormone, growth stimulating hormone, thyroid stimulating hormone, and the prolactin. And the suckling reflex also stimulates the milk production and removal of milk from the udder. This is essential to maintain the lactation. Now coming to the herbal galactogogues, there are many herbal galactogogues which have been used as effective nutritional regimen and they act synergistically to enhance the milk yield. This is the oat straw, dandelion, pot marigold. These herbal galactogogues they act through interactions with dopamine receptors by exerting an influence through adreno-hypothalamo-hypophyseal gonadal axis, resulting in enhanced prolactin concentration and thereby augmenting milk production. Some herbal sources act by exerting a synergistic effect, controlling stress and increasing productivity as they are rich in vitamins, minerals, and antioxidants. Oat straw, dandelion, vervain, lemon balm, pot marigold, chamomile are the herbal supplements which act as herbal galactagogue, stomachache, and carminatives by improving the efficiency of feed utilization. These indigenous herbs they are useful in improving reproductive health status, subclinical mastitis, and agalactia. Now coming to the what are the causes of decreased milk production in milking goats? This is the problem which comes to our mind. Why the milk production is going down? Because there's time since freshening of the goat. The milk production in young doe will slowly increase over the first few weeks of time. And when there is demand, there will be, and the supply is less, then the milk production is also less. The feed and nutrition, Milk production takes a lot of nutrients and energy. So balanced feeding and nutrition is very essential during the lactation period. And some parasites, endoectoparasites, they also have the bad effect on the health status of the animal. The high parasite load decreases the milk production. Other various causes are nutritional deficiencies, as I told you, calcium, phosphorus deficiency, magnesium, macrominerals, microminerals. These should be balanced. Balanced diet should be given. Kid mortality in case of goats, they also cause stress in the does and leads to less or no milk production. Then heat stress and drought condition, overheating of the shed, and no water supply, no feed, this will drought condition. They also lead to less production of milk. Then some bacterial or viral mycoplasmal or parasitic infection or systemic infection. These are also responsible for low milk production. Hormonal imbalance, as I told you, hormone is responsible for milk letdown and milk production. Then mastitis, already discussed, udder edema, endometritis, toxins and pesticides. These toxins, they are highly, very pathogenic to the animals when they go out for the grazing. These pesticides, they are sprayed on the fodder and feed which the farmers are using unknowingly. When the animals graze on such pastures, they will ingest, and this will cause toxicity and leading to reduced milk production. When the animal is in stress, this is a physiological cause, then also the milk production will go down. Now, how to diagnose? For this, the owner or the animal goat farmer, they have to observe the daily milk production by the animal. The owner will report that suboptimal or there is total lack of milk secretion. When he comes to the doctor, he will tell the doctor that there is decreased milk production. Then by culturing the milk sample, we can know the exact cause of the disease, which bacteria is responsible for mastitis. Then serological test includes ELISA test to detect the antibodies, and molecular techniques such as polymerase chain reaction is used for diagnosis where there are laboratory facilities. Then the treatment aims to mean combating the etiological factor. The treatment should be according to the etiology. If there is nutritional deficiency, then feed additives or mineral mixtures, vitamins, they should be given. The galactogog should be prescribed. Whenever there is possible, if there is no herbal product in that area, you can go for allopathic ready-made products. In contagious Agalactia, intramammary antibiotic infusion can be given. Intramammary preparations, there are many sulfur drugs and there are many intramammary infusion are available in the market. You can select, give it in the as an intramammary infusion, and also hot fermentation with magnesium sulfate is recommended in case of chronic cases of mastitis. When there is inflammation, teeth is hard and it is about 3 to 4 days old mastitis, then you can go advise for hot fermentation. Cold fermentation is advised with ice and cold water when it is an acute case of mastitis after 24 hours or 1 day. Then go for cold fermentation. The environment plays a very important role for prevention of the disease. The environment should be neat and very clean. The milking practices, teeth dipping should be done post milking, and before milking also the handler of the animal, they should clean the hands and the buckets and everything, and they should clean the tip of the teeth to maintain the hygienic measures for milking, collecting the milk in the bucket, and teeth dipping is done after milking, post milking to kill the infectious pathogens. Poor health udder, they may cause infectious diseases leading to fibrosis and obstruction of the teeth canal. Once the teeth is blocked, then it is very difficult for again to revive the teeth for production. And if the case is very old, then and if the milk is remaining in the udder, then slowly there will be development of gangrene in the udder. And that is the last stage. I have seen cases of udder gangrenous mastitis when there is sloughing of the teeth. The owner should take precautions before milking and after milking. Nutritional supplements. Nutritional supplements, it should be a routine factor that the feed is fortified with minerals and supplements. Then isolation of the affected animals. The isolation of affected animals is very essential. Otherwise, the milker will carry the infection to the healthy animals. And selective culling of the animals. Once it is known that the animal cannot be revived and it is the end stage of the milking, the animal cannot be cured, then such animal should be culled. Healthy quarters should be milked first before the infected quarters. This is a normal practice because if the unhealthy is milked first and then the healthy, the infection will be carried to the healthy ones. Now, herbal galactogogues, they are derivative products. They are used in dairy industry. Now, coming to the plant drugs. The plants, they are herbal drugs. They have phytopharmaceuticals and phytomedicines, which phytochemicals, they mimic the allopathic drugs and they can act, it is at par with the allopathic drugs. So in many researches, I have seen that we have taken a standard compared with the herbal drug, and we have seen it is almost at par. If it is one is 99 or 90%, the herbal is 80%. So, and it is also economical, easily available, and no, there is very few no effect. I have not seen any side effects. Then fruit plants or herbal teas, decoction and alcoholic extracts are the traditional ways of using medicinal plants. During this corona period, we have heard of lot of herbal teas and herbal decoction. We have taken lot of precautions using these herbal medicines. And same is the case with the animals. I have tried in pet animal herbal drug using giloy, Tinospora cordifolia, and tulsi, basil decoction we have given to the pet and dogs, and they, in case of acute hepatitis. So it gave a good result. So I can recommend for the goats as well. Then the herbal drugs, it acts through the intracellular receptor E2R that finally increases the level of prolactin and increases the secretion of milk. The second route inhibits the pathway activator by D2R dopamine receptor, stimulating prolactin production and proliferation of lactotrophic cells. The common galactogogue plants are fenugreek. The botanical name is Tragonella prunum gracium. Most commonly, it is in Hindi, it is known as methi. It is used as herbal galactogogue, family Leguminosae. It is found in India, Mediterranean countries, North Africa, Southern Europe. The seeds have mastrogenic effect, stimulate the growth of mammary glands, maintain lactation in ruminants and buffaloes. In goats, the dose is 10 gram daily of fenugreek seeds. This increases the milk production by stimulation of endogenous hormones via prolactin stimulation. The prolactin concentrations were found to be significantly higher in the fenugreek fed goats compared to control groups. In this matter, I will tell that I have used in my PhD research this methi along with chandrashur and Tatavar. So there was increase in milk production and fat percentage. Then fennel, which is known as Funiculum vulgare, it is a perennial and aromatic plant. In Hindi, it is known as saunf. It is found in southern Europe, Mediterranean coast, temperate zones, and around the world. It is a wild herb. Greek botanist Pedanius Discoloridis, he discovered this. It increases the milk and milk fat content. This galactogog is used in human beings, human ladies, and there is no adverse effect in mice or goats. It acts as an estrogenic agent, increases the milk secretion, improves the reproductive cyclicity, and contains estrogen-like molecules, anethole and estragol. Next is anise or Pimpinella anisum. It belongs to the family Apiaceae and the plant is found in Western Asia, Eastern Mediterranean, Mexico and Spain. The oil constituents obtained from dried fruits, trans-ethanol 93.9%, estragol 2.4%. Estrogenic activity is used as a galactogog. And aqueous and ethanolic extracts of Pimpinella anisum seeds, they increase the milk production in rats. This is in Hindi, it is known as zeera. Then goat's rue, gallagher or pinalis. It is a herbaceous plant from Central and Southern Europe. Increases the milk yield and lactation in daily diet of in cows and sheep. Low palatability and high toxicity due to hydroxy, gallagin, and gallagin. Lactogenic properties confirmed in sheep at daily dose of 2 gram of dry matter per kg body weight from the first month after lambing for 60 days should be given. Only 2 grams. The dose should be very less. It increases the total milk yield without any signs of toxicity. Next is Sathyazerograzing, Asparagus racemosus. This I have used in my research work. This along with Chandrashur, this has given a very good result. Satavar, but it is slightly costly. So it can be given in low doses. It belongs to the family Asparaceae, originated in India in Charak Samhita and Shushrut Samhita. So this is the origin of India. Retalax tablets used in women suffering from hypergalaxia is used as a ready-made source. Gradual decrease in milk secretion on withdrawal was due to drug therapy only and not to any psychological effect. Lactocare, this is a commercial product. This helps in the growth of the mammary glands, alveolar tissues, and acini. The roots have shown galactogog effect in buffaloes. This has been used by our department in the research work of PhD Satavari in 3 doses, 25 grams, 50 grams, and 100 grams in buffaloes. So one of our colleague has done this research in buffaloes, and he said that 100 gram is the suitable dose in case of buffaloes, increases the fat percentage and milk yield. There is growth of mammary tissues by action of released corticoids or prolactin. Next is milk thistle or Silybum marianum. In most of the herbal drugs, you will find this product. It is a mixture of flavonoids extracted from seeds, contains silibin, silidianin, and silicrystine, showing estrogenic effect. We get the ready-made product also in the name of silibin. The major component, silibinin, binds to cytosolic estrogen receptors. 10 gram of silimarin in cows per day per ox from 10 days before calving to 15 days after calving and increases the milk production to 5 to 6 liters per day per cow. Silimarin after calf delivery improves the physiological status of the cow, faster recovery, increased feed intake, increased milk production. The reduction of blood beta hydroxybutyric acid and decreased ketonuria in cows treated with silimarin has been reported. Next plant is alfalfa, also known as Medicago sativa. The family Fabaceae. The parts used are leaves. The chemical constituents, the plant contains alkaloids, flavonoids, isoflavonoids, carotenoids, phenolic acid, minerals such as iron, calcium, potassium, phosphorus, and zinc. It has estrogenic and lactogenic stimulant, thyroid stimulating hormone stimulant, and promotes the prolactin release, according to Zupa et al. 2010. Next is black cohosh or Semifuga resibosa. The family Raniculaceae, the part used is dried roots. The chemical constituent is glycosides, actin, chimicoside, chimifugin, macrotin, racemoside, isoflavonoids. It is immunogogue, antispasmodic, and nervine hypotensive. This is not easily available in our country, so we may skip this. This is black seed or black cumin or Nagella sativa. It is in Hindi known as kalonji, which is readily available. Belongs to the family Raniculaceae. The plant uses seeds. The chemical constituents are nicalicine, naglidine, thymoquinone, naglinone, ervacarol, flavonoids, stearyl glycosides, tannins, essential fatty acids, essential amino acids. It has an analgesic, anti-inflammatory, and galactopoietic effect. Next is borage or Borago officinalis. It belongs to the family Boraginaceae. The part used is leaf and flower. The chemical constituents are alkaloids, choline, minerals, potassium, and it is rich in potassium and calcium. It is rich in oil, omega-3 fatty acids also, and it is effective galactagogue. It has restorative effect on the adrenal cortex. Next is Caravay or Caram carvi. The common name in Hindi is Kala Zeera, family Umbelliferae. The part used is seeds. The chemical constituents are carbon, dihydrocarbon, carvicol, dihydrocarvol, flavonoids, limonene, thujone, transhydrocarbon. It is a lactational herb and it is a postpartum galactagogue. Now the herbal products which are under commercial use. We get the ready-made products as Pyrapro, Ruchamax, Lactofat, Lactamilk, Galactagene, Galactine, and one more is Lactadine also. If it is acute case and you are not getting any herbal plant in your area, you can go for ready-made products also. The herbal plants that having galactogenic properties, they can be used as herbal medicines. The standardization of methods and quality control data on the safety and efficacy are very essential. This is slightly lacking, so we are not very sure about the dose and standardization methods. So there is lot of research work needs to be done. Further research on phytochemical composition, pharmacokinetics, the dose rate, and detrimental side effects should also be noted.